Hey everybody, this is Modern Refugee, having my coffee this morning. And I want to talk to you guys a little bit about dental problems, dental items that I keep in first aid kits, dental problems while traveling. We got some travel coming up here that's all medical related in the next couple of weeks. And I'm actually putting together some of the dental items in a little kit here to take along with me on some of those trips, because I have been plagued with dental problems over the years. And unfortunately, I've learned a lot through experience, and I wanted to share that with you guys so you guys can learn from my experiences instead of having to figure this out on your own. Now, this starts with a story. The worst dental related thing that I had happened a couple of years ago. I had pain that started in one of my bottom molars right out of the blue, and just continued to get worse over a couple of days. Went to the dentist. Dentist says, "Oh, you got an infection in that tooth. You got to have a root canal done." Sounds simple. It wasn't. So what happened was they put me on an antibiotic and went for a couple of days. The pain got so intense I couldn't handle it. It was the middle of the night on the weekend, of course, because that's when bad things happen, when you can't get to any real help. I went to the local ER because I was just bewildered by pain. And next to my diverticulitis thing that I had here last fall was probably the worst pain that I've ever been in my life. The ER doctor said, "Yeah, it's infected. Nothing we can do about it here except give you some morphine and send you home." And that's exactly what they did. And I said, "Get a hold of your dentist first things." Got a hold of my dentist. I went in there. They tried to put Novocaine in that and open that tooth up. And that's when I learned the first thing. If the nerve on your bottom jaw is inflamed because of an infected tooth, Novocaine doesn't work. So they sent me home with more painkillers, more antibiotics, and that went about 10 days. The inflammation came down enough where they could put some Novocaine in, numb it up enough where they could open the tooth up. They got some of it out. It was too painful. Still too inflamed. Sent me home with more antibiotics. This went on 3 different times over the course of a month. Went into the dentist 3 times. Every time they increased the antibiotics, increased the painkillers, and until they could get that root canal done. They finally, after about 5 weeks, completed the root canal, put the cement in the tooth, whatever it is, and about 2 weeks later, put a crown on it. About 10 days, 2 weeks after they put that crown on it, the tooth broke. The root broke, and I had to have it surgically extracted anyway, and so you know that I'm not BSing you. You can see that gap there, and that's where the tooth used to be. So after going through all that, the tooth had to be extracted anyway. It was a huge, painful learning experience, and I have had another tooth recently that gave me problems, not near as bad as what this one is, but still pretty bad. Had to go in for a root canal, was on the antibiotics and the whole 9 yards. And because we're going away on these trips coming up here, I want to have stuff with me to take care of any dental problems that pop up while I'm out doing the other stuff that I have to do. So this is the kit that I got here, and I just threw everything in a Ziploc bag, and this is actually going to get thrown in with the vehicle first aid kit, so we have this with us when we're out doing our stuff. And got some of the basic stuff, that you would think you would normally have in a dental first aid kit, but then also some medication and stuff in here. Got dental floss, of course. Got dental floss picks, which are also very helpful. Got these from my dentist, and what this is this is basically just a medicated rinse if you have any infections or problems in your gums or any post-op stuff. I pump my dentist for all kinds of stuff like this when I go in there. Hey, you got any samples or anything you can give me? Most of the time, they're going to give that stuff to you. So this is what I got for that. Then I got the old standby oil of clove, and that's what oil of clove looks like. You can get it in a couple different variations. And then I got some little dental cotton balls here, because you would soak these in the oil of clove and then put that on the infected tooth. I also got a, and basically what it is, it's basically a painkiller, sort of like Orajel. And then I got some small tweezers that I can use to apply that. And then a couple of other more specialty things here. I got wax. This is dental wax that you can use to plug a hole in a tooth, basically. And then different pain relieving like Orajel. You can put an actual tube of Orajel into. And then I've got an actual cement that you can use. It's like a temporary cement for a cavity that falls out. You can get this stuff too pretty simply. And then I've got some other stuff here that I got from the dentist. This is actually an adhesive to glue a crown back on, kind of like a temporary adhesive. If a crown falls off, you can glue that back on. So you don't, a lot of times when you put a crown on a tooth, it's going to be cracked or something. So that you don't want to put any pressure on that, because it'll break away more and have more problems. So you want to get that crown back on, and that's what this glue is basically for. And a couple other things. Now for me, everybody, there are certain painkillers that work, over-the-counter painkillers that work better for dental for me than other stuff. Ibuprofen actually works better for me than Tylenol. They both work, but ibuprofen actually works better. And a word on antibiotics. With that Chase case that all the preppers talk about now, you can get the antibiotics a little bit easier now than you could before. You need to put a mental note in there. I've never looked at a Chase case in my life, so I don't know really what kind of information they put in there, but there are certain antibiotics that work better for dental infections than other antibiotics. You need to have that information in there. If you got one of those Jace cases, or you got any of that, those antibiotics that are marketed toward preppers now, you need to have that information included in there. I don't know if they put that information in there or not, but the information, I'm not going to tell you which antibiotics, that'd be unsolicited medical advice, but there are certain antibiotics that work for dental infections better than others. It's easy enough to look up online now with the internet the way it is now. You should be able to look that stuff up and get kind of a basic idea of what you would need to knock that down, because I'm here to tell you, if you got a problem with your teeth and it's SHTF and you can't get to the dentist for a while, you're going to have to do something to stabilize that, and you're going to be you're not going to be able to function. If it's as bad as what mine was down here a couple of years ago, your combat effectiveness is going to be near zero. You're not going to be able to do much except breathe and maybe walk around if you're lucky. But I wanted to let people know that, and I wanted people to know a little bit kind of what I put together for dental first aid kits, of what I take along with me when we're traveling. I keep a lot of this stuff in like home first aid kits, but it's a good idea to have something portable, because, things happen when you're not at home sometimes. But anyways, Modern Refugee, appreciate all my subscribers out there. Hope you guys got a little information, a little entertainment out of this video here. Appreciate you guys putting up with my little dental story there, but I think it has pertinence to preparedness and having some of this stuff. Anyway, appreciate you guys. You guys take care.